This is an EB-2 National Interest Waiver approval for a biomedical equipment specialist. No doctoral degree, no published research, and no U.S. employer on the petition. If you're researching EB-2 NIW eligibility for biomedical engineering or healthcare technology, this case is worth watching in full. For 14 years, he worked across hospital environments in the UAE and Pakistan, installing, servicing, and maintaining diagnostic instruments, chemistry analyzers, immunoassay systems, hematology instruments, patient monitors, and ventilators. He didn't just know how these machines worked. He knew exactly where the diagnostic process slowed down and why. His EB-2 NIW proposed endeavor had three connected parts. First, a point-of-care diagnostic platform that lets providers run tests at the patient's location instead of sending samples to a central lab. Second, a rapid diagnostic lab network built through partnerships with existing U.S. hospitals and clinics, not new construction. Third, expanding U.S. medical device exports to the Middle East, a market where U.S. exports had declined roughly 10% in 2023. Here's how the national importance argument was built under matter of Danasar. The U.S. point-of-care diagnostics market is projected to reach $22.3 billion by 2026. Over 37 million Americans live with diabetes. Nearly 92 million have cardiovascular disease. Roughly 795,000 strokes and 805,000 heart attacks happen in the U.S. every year. And for every one of those conditions, faster diagnosis changes outcomes. This proposed endeavor didn't need to invent national importance from scratch. NIH's RADEX initiative, NIBIB's Point-of-Care Technology Research Network, and the FDA's Digital Diagnostics Program all name rapid diagnostic development as a federal priority. COVID-19 made the gap explicit. The CDC's own pandemic preparedness reporting pointed to point-of-care technology as a tool that could have accelerated early containment. For the well-positioned prong of the Danasar test, the evidence wasn't theoretical. He installed and commissioned a Siemens Total Lab automation system. He spent a month on-site at the French Medical Institute in Afghanistan, training hospital staff. He contributed directly to the Joint Commission International accreditation of a major hospital. Approved. Self-petitioned. No PhD, no publications, no U.S. employer required. If you're a biomedical equipment specialist, service engineer, or technician asking whether the EB-2 National Interest Waiver is realistic for your background, this case shows it can be. Get your free eligibility assessment at amignis.us.